Hello, future nurses, and everyone else who's watching. Today's video is going to be about the nursing process. More specifically, we're going to be talking about the assessment portion, which is one of the 5 steps of the nursing process. Today's video is going to be focusing on the nursing assessments and the different types of nursing assessment, nursing versus medical assessment, the difference between those two, the difference between objective versus subjective data. We're also going to be talking about how we gather data and the interviewing techniques as it relates to assessment and how we validate data, amongst other things. Let's dive in. So, assessing or assessment basically involves a continuous collection, analysis, validation, and communication of the patient data so that we can understand their health status and the needs of the patient. Now, this particular process helps nurses to develop a comprehensive or a full picture of the care plan by just simply gathering or collecting relevant information from the patient and from other sources such as their family, the medical records, and other professionals, right? The initial assessment establishes a baseline data for making judgment about a patient's health and care needs, while ongoing assessments track changes in the patient's condition. Accurate and systematic data collection is very important to ensure safety, efficiency, and proper care. Nurses also verify any data that is questionable and communicate those findings that are questionable to other healthcare providers in order to support an effective treatment. Ongoing assessments. It requires strong critical thinking and clinical judgment. Ongoing that is very important in nursing. And the key task involved in assessment basically includes using this framework to identify nursing and medical concerns. We evaluate the credibility of those information that was provided to us. And as nurses, we're going to recognize normal versus abnormal findings. Nurses must assess the significance of data. They got to distinguish relevant versus irrelevant details because a lot of information is going to come to you, but you got to make sure you understand which one's important versus which one's not important. You have to understand key task and assessment includes using frameworks or different methods to identify nursing and medical concerns, evaluating the credibility of the information, and recognizing normal versus abnormal findings. And again, nurses must assess the significance of the data, distinguishing relevant from irrelevant details. It's also important as nurses that we identify any biases, inconsistencies, or missing information during data collection. Ensuring the accuracy and reliability of data is essential for effective care planning. When it comes to the essential elements of the nursing assessment, it's important for you to understand that we got to promote effective clinical reasoning, nursing assessments, and those should be purposeful, prioritized, complete, systematic, accurate, and relevant. Each assessment data that we collect should focus on gathering the necessary data that is important for specific purpose, whether it's comprehensive assessment, focus assessment, or whatever type of nursing assessment that we're conducting. It's important to collect the most critical information first because you got to prioritize accordingly, and then you want to make sure that all relevant data is gathered to fully understand the patient's health issues. Now, data should be collected systematically to avoid missing anything important, and you want to record it accurately to prevent any misinterpretation. Now, additionally, all data should be fact-based. It shouldn't be based on what you think or what you assume, okay? But all data has to be based upon facts and it has to be verified. Additionally, you got to make sure with any questionable information that you cross-check for reliability, and we'll talk about that more so later on in this video. Additionally, recording data in a standard format ensures it's easily accessible for all healthcare providers so that they can take care of the patient effectively. Now, when it comes to assessing, the primary source of information is the patient. There's 2 types of sources of information. The primary source is always going to be the patient, and everything else or everyone else is the secondary source. And when it comes to assessing, you gotta get into the habit of getting ready to gather your information. To get ready to gather information includes having all the equipment necessary, like the stethoscope, pen light, etc. You want to gather the information, look for clues, and make a conclusion based on the clues that you collected. You want to make sure you check the information, that it is accurate. You want to be able to group similar information and find any patterns, to note any patterns and differences. And once you've done that, you have to get into the habit of sharing that information with those who are involved in the patient's care. And you want to also write down that information or record it effectively. So let's talk about the initial assessment. This is one type of nursing assessment. So the initial assessment is done soon after the patient arrives into a healthcare facility like a clinic or a hospital, for example, and you collect those information based on the facility's protocols, right? Its goal is to gather detailed information to identify any issues and develop a care plan. The nurse collects information about the patient's health. They set priorities for future checkups and create a baseline to compare later on and to note any changes or deviation from the normal. Focus assessment is another type of nursing assessment in which the nurse gathers information about a specific problem that has already been identified. The nurse asks about symptoms, when they started, what triggers them, what treatments are being used. Now, this assessment can happen during the first checkup if new issues come up, and it's also part of regular checkups as well, or regular screening, okay? It helps find new or missed problems, and the nurse is going to continue collecting this data or this information in an ongoing basis, all for the purposes of making sure this patient is receiving effective quality care. Quick priority assessment is another type of assessment. It is also known as QPAs, and these are very brief, focused assessments or checks that helps the nurse gather the most important information right away. They're very important because they help identify immediate problems or risks or any dangers that that the patient may be faced with. Emergency assessment is basically done when a patient is in a life-threatening situation, sort of like what you see in a rapid response or code blue, if you've heard of that. Examples include a patient who is choking, a patient with a stab wound, an unresponsive patient, or someone who's threatening violence or causing harm to themselves or others. In each case, the nurse has to focus on urgent issues like what's causing them to choke in the first place, or how much blood is being lost. Is the patient even able to breathe? So you're going to check airway and breathing and circulation. You're also in a focus or emergency assessment. You're going to assess any risk of harm. In any event, the goal of an emergency assessment is to quickly find the problem and fix the life-threatening problems right away. Now, time-lapse assessment is another type of assessment done periodically just to compare a patient's current condition with their baseline data collected earlier. It's typically scheduled for patients in long-term care or those receiving ongoing nursing care, like, for example, patients in a home care setting or in a doctor's frequent doctor's checkup. This reassessment helps update the care plan based on changes in the patient's health. The assessment can be either comprehensive, where it's like from head to toe, or it can be focused, where it's just focused on one particular issue at a time. In triage assessment, the nurse is going to check patients to see how serious their issues or their problems are and basically suggest the right care for them. For example, a triage nurse at a hospital might answer calls from a patient with symptoms like shortness of breath or chest pain and decide if they need to see a doctor and if they need to see them immediately. During the pandemic, triage nurses helped cancer patients, for example, by assessing risk and giving advice. These nurses needed strong skills and good judgment because their decisions affected the patient's health and safety. When it comes to patient-centered care assessment method, or PCAM or PCAM as some have called it. It basically helps healthcare providers understand the patient's health by looking at social factors like lifestyle, surroundings, or their environments, and the knowledge of health that the patient obtains at the moment. It recognizes that patients' health can be affected by both long-term medical problems and social or environmental challenges. With PCAM or PCAM, providers can find out what might make it harder for the patient to manage their health and make decisions about care. By addressing these issues, healthcare providers can improve patient care and build stronger relationships with patients and their families. The tool also includes steps to help meet the patient's need accordingly. Before collecting data from a patient, nurses have to consider the type of information needed to create an effective care plan and avoid asking the same question repeatedly over and over again. Repetitive questioning can frustrate the patient and may seem like a lack of communication among healthcare providers. And let me tell you, patients get frustrated easily by that. Nurses spend different amount of times on various assessments depending on patients' needs, such as developmental stage, cultural background, and health concerns. Listen, the purpose of the assessment guides what information to prioritize and how much information you should be collecting. For example, assessing a child requires attention to their growth and behavior, while a patient recovering from surgery needs to be checked on their ability to care for themselves. Cultural factors such as language or beliefs should also be considered when collecting data. The type of data or information that a nurse collects depends on the patient's condition and the level of care required. Nurses should only gather information that is relevant to planning and providing quality care, avoiding unnecessary details unless they directly impact treatment. Let's talk about it. What's the difference between objective versus subjective data, and more importantly, what is that? So, there's two types of data, subjective data and objective data. Subjective data is basically personal experiences like what the patient is feeling. For example, pain or nausea. And this is only described by the patient. The patient themselves can describe what is going on, okay? Objective data is what's observed, what you can measure, such as temperature reading or visible symptoms. Okay, like the patient is actually grimacing. All right, this is what you, as a healthcare provider or as the nurse, can actually see. Okay, and it can be verified by others. Subjective data are also called symptoms. All right, subjective is the symptom, what the patient is feeling, while objective data can also be called signs. This is what the healthcare provider can see. The primary source of data for a nursing assessment is typically the patient. Let me say that again. The primary source of information that you are going to collect or gather data from is the client. Typically the client. You always want to go to the client first to get information. Now, this can change though communication may be limited by, for example, pain or confusion or even emotional distress. So sometimes you might have to go to secondary sources of information like the family or significant others, who can also be helpful with providing information, especially when the patient has limited communication ability, like they just can't speak for whatever reason. But it's important to ensure that the patient agrees and understands the confidentiality of this data. Very important. You've got to, at all costs, protect the patient's information. The patient's medical records, including their medical history, progress notes, diagnostic reports, and therapy records from other health professionals, are crucial and very important for gathering additional information. Nurses can also rely on technology like monitors to track vital signs and consult with other healthcare providers. They do that for a complete picture of the patient's health. Finally, the literature on specific conditions may be consulted to provide additional context for the nurse when assessing a patient. Let me tell you something. Nursing in and of itself is an art. And when it comes to collecting data, there is an art to it, okay? The art of nursing observation includes checking the patient's current physical and emotional state, looking at the patient's ability to manage their care, assessing the safety of the immediate surroundings. And as a nurse, you got to get into the habit of looking at the larger environment, like the hospital or the community. Now, when it comes to helping the patient, okay, or collecting data, let's look at, say it like this. When it comes to collecting data as an art, think of the word help or the acronym help, okay, which is a mnemonic that helps you to understand when looking for early signs that the patient might be in some sort of distress and they may actually need help, okay, like a pale skin, or they're in pain, or they're having trouble breathing. So the H in help, just basically you want to look out for helping the patient, looking out for early signs. The E in help is environmental equipment, okay? You want to check for safety risk and make sure that the equipment is working, like, for example, the IV monitor, the oxygen, or a catheter. The L in help, you want to look. This is where you are observing. You are examining the patient carefully, making sure that the patient is not in any distress of sorts. And then the P in help is people. The P stands for people. You want to identify who's in the room and understand what it is that's going on and what is it that they understand and what in the world are they doing in the first place. Okay, you as a nurse need to understand what's going on, who's there, and why are they there. Okay. Furthermore, there's methods of data collection. When it comes to data collection, you want to get into the habit of looking at the nursing history and physical assessments, which are important parts of collecting data. It can be written on separate tools or basically in one form, okay? When it comes to observation, it is very key in both steps where the nurses use their senses to gather information. Now, when it comes to the nursing history, it helps nurses to understand the patient's unique needs to provide personalized, select information, and followed by physical assessment. Key parts of the nursing history includes gathering their profile information, like their name, age, gender, ethnicity, marital status, their job, or even education. You want to know the reason for seeking care, like why is the patient here in the first place? Why does the patient need help? You want to know their health habits and their health needs, usual health patterns and communication. What else? The learning needs are all important information that you want to collect as it relates to knowing about their health habits. Cultural consideration. Nursing is about providing cultural competent care. So in providing cultural competent care or considering their cultural background, you want to assess their diet, what it is that they do in terms of decision making and what are their preferences for activities. You also want to collect information about their current and past health, which includes physical and any vaccinations. Their perceptions and coping mechanisms. You want to know how the patient views health and illness and what's their coping methods and what are their risk factors as it relates to coping mechanisms. Other information that you want to collect is family and social history, so the family background and environmental factors. You also want to know about their expectation and educational needs, in which you want to understand what the patient and family expects from care and how they can learn and participate. Let me say this again. You want to know what the patient and anyone else involved in the patient's care, what is it that they expect from care, all right? Got to know that. It's very important. The nursing history is collected through a structured interview with the patient in 4 steps. You're going to prepare for the interview, where you're going to look at what information you already have on hand and what equipment that you're going to need to collect relevant information. You're going to introduce yourself. It's going to also include working with the patient on a continuous basis, and then also, like everything else, the conclusion of the relationship between the nurse and the patient. Good interviewing skills and empathy are key to building trust and gathering accurate information. You got to get into the habit, as great nurses that you are all destined to be, to collect data in an empathetic manner and you gotta have the right technique. You gotta know how to communicate effectively with this patient, and you need to know what it is that you should and should not say. Physical exam or physical assessment. This is when a nurse examines a patient to collect objective information that helps understand their condition and plan the right care. This usually happens after taking the patient's history and interviewing the patient, either confirming or adding new details. Yes, while doctors usually do a full assessment, to diagnose conditions, nurses, on the other hand, they're going to focus on the patient's ability to function, like thinking, communicating, or doing daily tasks, especially if they have conditions like a stroke, for example. Nurses may use different methods depending on their setting, such as in intensive care units or in rehab. So the type of physical assessment or health assessment you conduct depends on the setting that you are in. Okay, listen. There's 4 main assessment techniques that you have to be familiar with. The first one being inspection. This is the very first thing that you're going to do anyway, which involves you carefully looking at the patient in an organized way. Palpation is another assessment technique which involves you touching the patient to check on things like the skin temperature, texture of the skin, moisture, vibrations in the body. Percussion is another assessment technique that you have to be familiar with, which involves you tapping on the body to make sounds. Auscultation involves you listening to the sounds inside of the body with equipments like a stethoscope or a Doppler. Palpation and percussion, you gotta understand, is typically done by an advanced practitioner like a nurse practitioner or a physician, but you as a registered nurse has to be familiar with those techniques. Now, there sometimes can be problems when you're collecting information or gathering data. Okay, some common problems in data collection includes disorganized data. Like, you just poorly organized, you all over the place. That's a problem. Okay, your data should be structured and well organized. Okay, that helps you helps you avoid missing pertinent information. Other problems include missing important information, including irrelevant or duplicate data, and misinterpreting or recording inaccurate data. That's going to be a huge problem. Other issues can involve not building a good relationship with the client in the first place. Like, from jump, you already have a problem with the patient. That can poorly compromise the care of the client. Other issues can include recording interpretations instead of observed facts. In other words, you recording what you think or assume is happening instead of recording what actually happened. That's a huge problem and a big no-no. Okay. Other problems can be failing to update the database. Like, there was a change an hour ago, but you didn't update that change, and that can compromise care. Some things you could do to fix this include reviewing the guidelines for specific or pertinent data. You may want to, for example, practice interviewing strategies. If you have irrelevant or duplicate data, like you repeated some information, maybe you want to determine the specific purpose of data collection for each of the patients you're taking care of, and consider any existing data before even starting collecting data again. You may want to review and practice communication techniques. You may also want to identify the general data. So you could do a lot of things to help remedy or avoid making these mistakes when collecting data. Now, how are we going to confirm what we've observed? Nurses use cues and inferences basically to analyze data. Cues are pieces of information like, for example, the patient does not respond when I speak to him on his left side, while inferences are judgments made from those cues, such as the patient's hearing may be impaired on his left side. Does that make sense? So, to help you better understand, cues are the facts or signs you observe, like the high temperatures or the patient saying that they feel dizzy. This is what you've observed. And inferences is basically the conclusion you draw from those cues, like thinking the patient might have an infection because of the fever. To validate inferences, nurses can use physical exams, clarifying statements, they can consult with other team members, they can review research, they can also compare with normal functionings or check consistency of those cues that they've collected. Validation can happen during data collection or even afterwards, and once confirmed, the nurse needs to move on to analyze the data and develop a nursing diagnosis, which is a later step in the nursing process. Listen, as great nurses that each of you are destined to be, you need to know when to double check the data and ensure that it's on point, okay? Or when it's accurate, in other words. Validation is the process of confirming or verifying information to ensure that it is accurate. It's important to validate data when there's discrepancies, when the information just don't look right. So, for example, there's a discrepancy between what the patient says and what you as a nurse have observed, or when the data lacks objectivity. For example, let's say the patient say they feel fine, but their body language suggests otherwise, like they're grimacing or they're holding on to a body part, but yet they say they feel fine. So you gotta check that. As a great nurse, you gotta clarify that information, because you got to know what you're working with. Validation or validating data helps to ensure that the care is based on accurate information, and this helps prevent errors in nursing care. Registering information. When a patient is admitted to the facility, their initial information should be entered into the computer or written down on proper forms the same day as soon as possible. Try not to delay when you input information. If any important details are missing during the first assessment, it is important that the nurse makes a note of it so it can be collected as soon as possible. The information should be clear, it should be complete and easy to understand, and more importantly, it gotta be written so that everybody understands what the heck is written in the first place, right? With proper grammar, of course, and with the standard approved medical abbreviation. That's very important. To make it easy to find later, the data should be organized under clear headings. All right? Don't try to be confusing people. It's just not cool. Whenever possible, use the patient's own words to describe their symptoms, placing them in quotation marks. That's the best thing ever, okay, whenever you're documenting the information. Such as, you can put in quotes, I feel tired from the moment I get up in the morning. I have no energy at all. You could put those in quotation mark, and that's going to simply indicate that the patient said those words, okay? If you're going to be paraphrasing, you can say the patient reports feeling short of breath when walking up the flight of stairs. It's important that you avoid using vague terms like adequate, good, or normal. You got to avoid those terms, because what may be good for you may not be good for another person, or what may be considered normal for one person may not be considered normal for another individual. So you got to be as specific and precise as possible, okay? When it comes to patient confidentiality, let me tell you something. It is your duty as a nurse to protect the patient and protect their information. You gotta protect the patient. You're a security guard. As you gather patient information, you'll learn details they wish to keep confidential. Like, it's not everything that patient wants the whole entire world to know. So what they want to keep private, you gotta keep it private, or else you're gonna get in trouble. And it's well within their right to have that information protected. If family members are present during assessment, you should ask them to leave or get the patient's permission for whomever is there to stay. If the client says it's okay for them to stay, then it's okay, let them stay. Of HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. They're the ones that tell us how we are supposed to protect the patient's information. The ANA, or the American Nurses Association, and also the National Council of the Board of Nursing have also worked together recently to offer guidelines for nurses on how we protect information, especially when we want to be up on social media. And that concludes our presentation on the assessment. I hope this presentation has helped you. If you have lasted this long, I have added an extra bonus for you, which is some practice questions. All right, I got about a couple of questions that you may see the style of questions which may be asked on a nursing school exam. Ready? Let's go. Thank you so much for watching this video on nursing assessment. Listen, your dedication to learning is what makes the nursing profession so impactful. If you found this video helpful, please give it a thumbs up, share it with your fellow classmates, other nursing students, and subscribe for more valuable content to support your journey. Together, let's keep growing and making a difference in patient care.